Good evening. Today we're going to talk about something disturbing. It was a woman who died from suicide, who was a nurse in New York City during the pandemic of the Covid-19 coronavirus in 2020. She was a supervisor of the emergency room and looked up as a profound professional. She died because she couldn't handle the horrific situation that she was put in. New York City being epicenter of the United States during a critical time of the pandemic, whereas the hospital is overloaded with patients and consequently deaths due to the pandemic. Obviously, she saw the horrific situation and somehow could not handle it. Now, as philosophers, we speak of wisdom. We speak of a deeper truths and justice beyond common sense, and sometimes beyond psychology, into the whys of a situation and preventative situation. So, our task is to decipher the situation and put it to practical applications in our principles so as we can fall back on our conclusions as best possible. That is, the conclusion being our best possible situation and deduction for the time being. How we can approach it in the future, how can other people approach it in the future to make it a better situation, and to possibly talk about the cause. Now, this will involve psychology, but psychology was a part of philosophy and stemmed from philosophy in the beginning and began its own science, but philosophy includes psychology. But we want to go deeper than psychology in the whys. We want to find out what was corrupted in the principles for this lady to feel so distraught that she did not want to live. Now, I could tell you my own story, but I will vaguely tell you about my own story within the situation and development of this problem proceeds. The idea that someone is so distraught, shell-shocked from a horrific experience that they would want to commit suicide, they have to, there's some techniques that we would use as something beyond common sense, something that would take a little bit insightfulness. Certain things we know that can be, and somehow we can test this through our principles of right and wrong. What we know is this lady could not handle the situation. Now, what we do in a crisis, and what I do, but when anybody does, and we can discuss this to some degree, but in a situation of crisis, you slow down and you stay focused, and you get in a position where you can look at something clearly. Obviously, if your mind is inflamed, which stress really is to the mind, is an inflammation of the mind, even the mental state, we might call it. I think we can understand that the mind is not working properly, whether through anger or through stress. It's not, the mind is not normal. The mind is not in a position to think clearly. So we want to, in order to think clearly in this situation, we want to slow everything down and allow our mind to come into focus and to be in a situation where you can think properly. Now, some things we do, or we've been saying, is something, take a deep breath, many people say. We seem to think that's common sense, but it goes deeper than that. I mean, this is what I'm saying. When you say take a deep breath, that means slow down, relax, think of what you're going to say, think of what you're going to do. We often say that in a common sense way. So there is some truth to that. Count to 10. The anger of the man is equal to the anger of, I don't know that saying. I don't want to, it's not politically correct. So I'll negate saying that saying. But when we're angry, we are not ourselves. I think I've given you enough examples of what we're talking about. So we want to slow things down. We don't want to get hysterical. We want to slow things down. We want the mind to slow things down. We want to get into a frame of mind where we can think clearly. That's the first thing. Now, I don't know what this lady did, but I doubt she did that. So how I do this is I actually go in a room, lay in bed maybe, or get into a comfortable position where I can totally relax, close my eyes. I mean, if it's that serious a problem, and ignore the stimuli that's around me, so that I want a complete silence and relaxation, and bring down the noise of my brain as quickly as possible. Now, once you're in that position, you can think of good thoughts, more relaxing thoughts. For instance, mountains, horizons of beauty, earthly photographs in your mind that one does to relax. Often, sometimes before we sleep, we start to think of these thoughts in order to calm down from a stressful day. So if we do that for an hour, 2 hours, just lie there, or at least I do that. Some people want to meditate and have nothing in their mind, which is sort of a nothingness. I think that's good initially, but it's a matter of allowing the experience to be lifted from the mind gradually as well. So you don't want a totally blank mind, but it would be okay at first. But you want to let those images dissipate and flow through your mind. Even review them. Slowly review them. Not by focusing on any one, but allowing them to come to the surface of your conscious mind, allowing to flow outward, so that if once you review the situation, it can be released. Whether or not you realize what's happening, I don't think completely eliminating the problem or the images that brought the stress on is not a bad thing. That it's good to allow those things just come out in your mind and let them dissipate as badly. Now, that's not easy. I think you have to be totally relaxed in order to do that. And you have to not just have a blank mind to do that. You have to allow those slowly to be released. Now, as they come into the mind and they're released, they're relived. And it's this reliving of such horrific experiences and images. This is also therapeutic, so that you don't hide from those images. You don't suppress them, so that all you can remember is the horrific emotion. So it's important to relive it, and so you can release it. You don't want to suppress it, because then you become in trouble. You really don't gain anything. Once you get up, start moving, if you haven't released those images and experiences, the mind will suppress those images and nothing will be solved. That something will trigger something while you're talking to while you're moving around in an ordinary day. Something will trigger that suppressed image, and a terrible, overwhelming experience or a feeling will happen in the mind throughout your body, and the person would not know why it is, what happened, what's going on, and they can't break through to remember what that situation was that brought those terrible feelings on in the first place. So this is part of psychology, and it's also a technique. We do know that when something happens, horrific things, you need time to stand back and think of it. If you don't allow this time to rejuvenate the mind, then you become in trouble. That's why sleep is so important, because the mind rejuvenates, recharges from the day before. And what happens when your mind is not, your mind is still active even in sleep. And when something traumatic happened in the day, you'll have these vivid dreams of but this is a release as well, a therapeutic and a good thing for the body. So we also know that this happens on a normal level, a normal everyday situation. Now, there are other techniques of stress relief, but the most important is what I explained, that you have to release it slowly. It might take a few days. It might take a week, especially in her situation where she was in the ward for several days, maybe weeks. So there's a lot to get out. Now, sometimes a counselor is good for that, depending on the counselor. How effective he is. Does he allow those images to be released? Possibly through free association, which means allowing the woman to express herself through oral release. In other words, talking about it. That can take a lot of time, especially if you go to a counselor for 1 hour. Whereas if you can do it yourself in a room, in a quiet room, in a quiet place, and allow your mind to do that, release it, and let them float away and what you realize what you're doing and allowing those images to be reviewed, then you can do that for hours until you feel better. Now, why would you feel better? Well, you wouldn't suppress it. You wouldn't suppress it and just put it in a place where it could be displaced or projected later on in your life. And projection is having anger and then putting that on other people. Displacement is having the anger or frustration surface in another way, in another situation. So that damages your personality. So it's a cleansing and making room for normal thoughts again. Accepting traumatic experiences is hard to do, but it takes a lot of patience. We see this in animals. If we see a rescue dog, a lot of times they're shivering, and if they've been abused, have had a shock to their life. We often see videos of how dogs are just, they're afraid of everybody, might even bite people. But with love and care and patience and some medicine to help them get better if something is wrong with the body, we have seen many cures become lovely pets. But it takes patience for the animals, and we have often, a lot of us have done that, so that they become much healthier personality. We're no different. We're certainly more complicated, but I'm giving that example for us to realize that this is something that is expected in this world under the situation, under the conditions. We see this with men in service. We see this in wartime. We see always in wartime when two men are in a foxhole and one person gets shot. And, I won't get too graphic, but you can imagine how graphic it can be. And it's pretty horrendous, horrific, and really brings you a place that you don't feel is real. So that's what this lady experienced. And I believe that we have to understand the principle of slowing down, relaxing, being focused, allowing truth to come in and to be released. Now, these are some of the things we want to talk about in philosophy or as in wisdom, to understand the deep understanding of a traumatic experience. And sometimes in this culture we don't get that deep. For some reason, even in everyday life, we see people rushing around. as if it's a fun thing to do, to be busy and to multitask and to it's almost I understand that people enjoy it, but to think that that is the proper way to find truth and understanding is false. To understand things and to especially important things that deal with our conscious, what some might call our moral compass, what we think is right and wrong. How do we act? How do we apply things? How do we live in this world and be content and deeply satisfied with our life? You certainly can't be deeply satisfied if you have something boiling up in you that needs to be released and you don't know how to accept it. It's almost like a boil inside you of inflammation that needs to be released, or you will become diseased. And this is what happened to this lady. It's important that we help people. We talked about one principle that we can accept, and that was do unto others as you do they do to you. Now we wanted to start with one principle that we can understand and accept. And though we haven't proven it without doubt that it works, we willing to accept it for the time being, since most philosophies and most religions have accepted this on moral grounds. So if we put that to this situation, we certainly would want somebody to help us out, and we would want, if they were in a situation, we'd want them to help us, and if they were in a situation, we want to help them. So if we can help a person like this, one of the good ways to help a person is always be gentle with people. You can figure it out. If a woman, that's why I think that there's a lot of people who are congratulating, or not congratulating, but supporting health workers in this pandemic by giving them a sign of appreciation. Now that's what this lady needed. She needed a hug in a figuratively way. Now that hug can be through applauding, when they come out of the nurses' quarter and showing some support by people, which has been done. A lot of bystanders would show this, and other different ways, small ways, video ways, small chat ways. Always put something, thank God for the health workers. This goes a long way. You don't have to perform therapy on them. You have to give them a hug, and that can be done in a simple manner. Thank you. Saying something nice to a person you see in the front lines. Not only that, but especially when they're in the middle of things. This lady might have gone home every couple of days, and that time that she went home, she needed support. Maybe she didn't have it, and she needed relaxation. She needed relaxation so she could release, recharge, and release. We have to, as a philosophy and wisdom, a person of wisdom, you want to be able to fall back on your principles on a time like this. For instance, number one, we talked a lot about the slowing things down, relaxing, getting rid of the stimuli that's available around you, and bring you totally into a peaceful mood for a while, and then slowly releasing some of these toxic thoughts. And that's very, very difficult. Any kind of other congratulatory support by others or appreciation is good too. This is something that we can do as somebody looking on. But also we have to recognize what is happening to this fellow person. Obviously, we have to put two and two. If a person is working on the front lines, we have to do a little research and maybe look at some videos or look at some history about how horrific it can be in the front line, whether it's war or where it's in health, and put ourselves in their shoes. That's a part of doing unto others as you would do unto you. You would put yourself in their situation in order to understand what they're going through. And once you understand what they're going through, you want to do what they would in turn do to you. This is not too complex. This is a simple principle that if we accept that principle, as so many have in the past, we can use this wisdom to help this lady and also for her to help herself. She might have sought out somebody could help her too. I don't know if she sought out somebody, but in a situation like that, you want to be able to take a hug from somebody else. And if you want to ask people for support when you're in a critical situation. We are human beings who support each other, and we want to reach out to people to support us when we're down, and we in return have to do it to others. So you have to ask for the support as well. You can't hide. So it's a part of her well-being and also her moral principles of what is right and what is wrong. So if she knows that she's helping other people, she should be able to know that she could reach out and get help. She had just helped a lot of people. Perhaps she didn't realize that doing unto others as they do unto you, if that's a code for her and others, she certainly should say, well, I need help too, and reach out to others when necessary. It's a balanced situation. You have to know where to go for help. Someone who is not going to be selfish, somebody who knows that principle, somebody knows about gentleness and kindness. Now, we haven't put gentleness and kindness in our principles yet, but we're close to it, because when we talk about gentleness, we're certainly talking about slowing things down and trying not to hurt anybody, because we're in a fragile situation when this horrific situation happened. And this is where we need to support the most. We exhaust our self mentally. Our immune system, internal immune system, our mental immune system goes down from exhaustion. We know that. We know that when we're exhausted, we're not functioning properly. I've seen runners almost get to the finish line and they can't go any further. 10 or 15 feet from the finish line, they collapse, or they just go into a state of not knowing where they are from exhaustion or from perhaps dehydration. So they'll be good. They'll be all right, as soon as they get, in a few moments, or if they get some water, or if they just relax for a few minutes. But at that moment, they've worked so hard that they're completely exhausted, unfunctionable. This lady was unfunctionable. She had exhausted. She was a professional. She was a lady who made decisions. She was astute. She wouldn't have had a job like that in New York City, and certainly not a supervisor of a. So she was one that gave it all until she became exhausted at the finish line, and consequently was so exhausted, and so deprived of energy that she couldn't think straight. That's why I think we have to, if we have this thing in our principles, that we need to slow everything down. We have to know when that happens. We have to tell people we need to recharge. I can't focus. It's an art of telling people this, because people do not understand oftentimes. There's not a visual thing. They say, oh, one more time. At the gym, they tell you, oh, you can lift that 300 pounds, 200 pounds, one more time. We have a tendency to do that. Oh, can't you come in one more time? We can't take a break now. We need you. So you're getting this treadmill, and you can't stop until you need to be able to tell people that you have to tell yourself, but you also have to tell your peers that there is a time when you can't function properly anymore, and you need to recharge. Now you might say, I'm just feeling terrible. I can't function. I need to recharge. You need to learn how to say this in a way that people will leave you alone and stop bugging you, because this is often the problem, that one doesn't know how to tell the people around them that you've reached a limit. And when they egg you on, this is often the problem. So in order to say no in a graceful manner is a part of wisdom as well. You might call it even an art form, or in the realm of aesthetics, and fluency and poetic situation. So eloquence is important, how you say things. And it can't be underestimated how important it is to persuade someone. It's the same way as if you want to ask for something, there's a way to ask for it, and you'll receive it if you say it gracefully in the right terms. One should practice this so that if such a situation like this comes, you can bow out gracefully. And it's very hard when you're so exhausted you can hardly move. You need to be able to express yourself, and not, because when somebody tells you one more time and you're not thinking, so you're so exhausted you go along with that person because you just don't know how to say no. So that's another thing that this woman could have done, could have learned. And it's up for us to learn this, so that if we fall in this situation, and again, this lady was a professional in the way that she was was knowledgeable. She knew her trade, and she wouldn't have been in that position if she was not someone who wasn't capable of thinking clearly in 99% of the situations. And she certainly had, being a supervisor in a ER emergency room, she had certainly run across tragedy beforehand. But this went to the extremes, and she wasn't prepared. Why does anyone really feel a suicide was the right thing? I think there's a time I want to talk about suicide in general. If somebody was in despair, or then that's a bit different than this. This was something was brought on probably by mainly exhaustion and lack of support and lack of a fundamental way out, and not taking that time to reflect. So if a person was in despair over months or a year and didn't think he was worth living and sort of planned out a suicide, well, that's completely different, and that would be handled differently. But this situation, I believe it was more of a something that she would not do ordinarily. And this is why I've given this more of an immediate situation, that it was tragic, and people in the front line will experience more of this, and so will American citizens, American residences. As we see this pandemic spread and take hold, we have to go back and focus and slow down and not allow the stress to get a hold of us. We have to go back to some principles that we might have learned, and if we don't have them, then we better figure them out quickly. We have to help each other. I think we agree on that one principle. And because we have to help in a very tense situation and in a fragile situation, we want to slow down. We want to be gentle with each other. And you want people to be gentle with you. You don't want them to rush you or make decisions for you. You want to think things out. You want to take a deep breath. You want to not rush. And these things, I think you can understand. And this is important to understand it. And when you're at a critical situation, back down from it. Take a deep breath. Get away from it. Go into solitude. Nothing wrong with that. Allow the situation to be slowly unraveled so that you, in a good state of mind, can make some decisions that are based on your wisdom, based on things that you've thought about in the past. You can rely on it. We are going to possibly see deaths from friends and from family, and we see it come closer to us. You see, as the more people get infected and die within our area, and so we'll see the changes in front of us. But instead of panicking, we mean to go slow. We need to slow down. We have to think of other things to do. It's a good time for reflection and to build up some principles. Why should we? Is this something that we can use throughout our life? Well, we'll talk about that in further discussions. But I wanted to talk about this lady, a tragic example of something that went wrong that we must learn from so we don't make the same mistake for ourselves and for our people around us. Don't forget to say good things to another person. There's always something to be said you always can find something good about a person. And this time, if you see kindness being acted or some gentleness, or even if you don't, you can talk about the subject. so that this is not a bad thing. This is a good thing. Slow everything down. Take things seriously. Truth is serious. We know that. Finding truth is serious. Truth is beauty. Beauty is truth. But it's not running around in a crisis. It's not making quick decisions on impulse. It's allowing you to think things clearly before you act. Thank you.